Well, with the sixth wave of the pandemic already hitting some parts of the country, Chief Public Health Officer Dr. Theresa Tam is urging everyone to take a vaccine plus approach. She says that includes getting booster shots if you can, wearing masks, and limiting personal contacts. Dr. Tam says a booster dose further increases vaccine effectiveness to over 90% against severe outcomes. Her advice comes as scientists are saying that an extra contagious version of the Omicron variant is spreading globally, although it does not seem to be causing more severe disease. Well, with us to discuss the sixth wave and the vaccine plus approach is Dr. Abhishek Raut, Medical Director at the Appletree Medical Group. Sir, welcome back to Forum Daily.
Pleasure to be here.
So let's start with this. Dr. Tam says Canada is experiencing a sixth wave of the pandemic. What does this mean to viewers across the country?
Right. So what we're seeing this week, COVID-19 hospitalizations and cases are on the rise all across Canada, marking really the beginning of the sixth wave. As of Monday, the 7-day average of lab-confirmed cases sits just below 10,000, which is nearly a 50% jump from just 2 weeks earlier. Hospitalizations are also rising with about 5,000 people currently receiving care, up about 17% from last week and 30% above the number 2 weeks ago. So we're seeing a steady increase there. Of those who are in intensive care, we are seeing approximately 400, which is a slight uptick. So projections do show that these hospitalizations will continue to rise in the next 2 weeks as part of the sixth wave.
Dr. Tam is urging a vaccine plus approach to the pandemic. What does this look like?
I think it's very smartly named approach. Vaccine plus is basically a layered approach where we take precautions to reduce transmission, protect vulnerable people, and really ease the impact on the healthcare system. So vaccine plus masks, vaccines plus limiting personal contacts, vaccines plus boosters. So it's an interesting shift to personal responsibility. No one is forcing you to do these things, but we do know that it's the right thing to do in the middle of a COVID wave. And these are all very important measures to consider as we approach many holidays, such as Easter, Passover, and Ramadan.
Absolutely. So is this any different, this vaccine plus approach, from what public health authorities have been recommending throughout the pandemic?
I think Dr. Tam has also acknowledged that provincial and public health authorities are trying to encourage good habits without necessarily forcing them on people. But context is tremendously important. I think in different communities, depending on the context, the social cohesion, and other variables, each of these policies works a little bit differently and under different circumstances. So in many provinces and territories, we have some differences in these recommendations. But I think people are really keen to see and trust that we as a whole are able and willing to employ a lot of these changes and layers of protection as part of Vaccine Plus.
Very interesting, Dr. Raut. So meanwhile, today, the CDC is reported to be extending the travel mask mandate for another 2 weeks. How does public masking protect public health?
So community masking substantially reduces the transmission of COVID-19, really in 2 ways. First, masks prevent infected persons from exposing others to COVID by blocking the exhalation of virus-containing droplets into the air. This is what we call source control. The aspect of mask wearing here is especially important because it's estimated that at least 50% or so of transmissions are from persons who never develop symptoms and those who are in the pre-symptomatic phase. So blocking that source control is tremendously important. Second, masks protect uninfected wearers. Masks form a barrier to large respiratory droplets that could land on an exposed mucous membranes in the eyes, nose, or mouth. So masks can partially filter out small droplets and particles from the inhaled air. There's a lot of diversity of masks out there, so it can be hard and confusing to know which to get. But broadly speaking, multiple layers of fabric or material are better than single layers.
Well, shifting here, we know the growth of stealth Omicron is spreading globally. I know we've discussed it before, but what do we know about it? What do we know about stealth Omicron?
Stealth Omicron, or BA2, is an extra contagious version of the Omicron variant. It doesn't seem to cause more severe disease. It was first identified in November, and it really has spread around the globe. It's the dominant coronavirus strain in Canada currently, and more than about 5 dozen other countries. It's given the name stealth because it looks like the earlier Delta variant on certain PCR tests. And the original Omicron, by contrast, was very easy to differentiate from Delta.
Interesting. Well, just about 15 seconds, Dr. Raut, but where can viewers go if they want to learn more about whether they're eligible for booster shots?
Well, we know that the best place to go would be your local province and territory's health website to look for booster eligibility. And if you have any follow-up questions, always discuss with your family doctor.
Dr. Abhishek Raut, thank you very much for joining us today on Forum Daily.
Thanks for having me.